Hi everyone, it's Missy again. I got notes this time, so that maybe the video won't sound as bad as the last one I did. Of course, it didn't help that I'd been awake for 2 days. I didn't sleep last night either. It's that time of the month for me, and whenever I have my period, it makes my back and pelvis hurt a lot worse for at least the first few days. But I did want to touch upon yet another topic. Dealing with judgments and negativity from others. We get judged in so many different ways. I'm going to separate this topic out into each individual way, and then kind of bring it all together on a last video about ways of dealing with it. The first thing I wanted to touch upon was how we get judged solely for having an illness or an injury that causes pain. People with chronic illnesses and people with chronic pain, many of whom have both illnesses and pain, face a great deal of judgments and stigma from others, from their family to their friends, and even from medical professionals. Many people with illnesses or pain go for years misdiagnosed, told that they're crazy, it's all in their head, they're depressed, they're anxious, anything and everything, but the medical professionals actually trying to find out what's wrong. Finding a medical professional that is willing to actually treat you when your symptoms are vague or your only symptom is pain can be quite difficult. We are judged for having these illnesses and injuries to begin with. We are told things such as, well, you don't look sick. I've never heard of that illness, so that it can't be real. You must be faking. It's all in your head. I had a friend, relative, acquaintance, my cousin's friend's husband, whatever, had that, and they got better just by exercising or following this diet or taking this pill or whatever. And people with chronic pain hear this one a lot, especially if it's back pain. It can't hurt that bad. I have a bad back and it doesn't make me hurt. Hearing those things is just so upsetting. It's painful, it's dismissive, it's rude. Every person is different, and how their body responds to an illness or an injury can be different from somebody else. Pain is subjective, and science has proven that people have varying levels of tolerance to pain. Some people have a high tolerance for pain, some people have a lower tolerance for pain. Some people have an overactive nervous system that causes them to feel a much more intense pain than somebody whose nervous system is not overactive. Not everyone has the exact same symptoms and the exact same intensity or frequency of these symptoms, even within the same group of illnesses. Watch a few videos from different dysautonomia patients, and yeah, a couple of symptoms are the same for all of them, but other symptoms vary depending on each one. The same goes for chronic pain. Somebody with a herniated disc may feel no pain at all. Another person with a herniated disc may be in agony. It depends on how their body responds, where the disc is herniated, many different factors. We're not all the same. Telling a chronically ill person or a sufferer of chronic pain any of these things and similar judgments is, in my opinion, flat out wrong. Do some people make these statements because they believe them? Or do they say them out of fear, or in the hopes that somehow by dismissing this in other people, that it protects them from possibly getting sick or getting injured in the future? Could it be the same old stuff that we all dealt with in high school, of people putting down somebody else in order to make themselves feel better? I don't think there's a universal reason that fits everyone that insults the chronically ill or chronically pain patients. I think they have varying and different reasons for behaving in this manner. One of the biggest would be lack of compassion and lack of empathy. And those can be learned if they're not inherent. For some people it is inherent, and they're raised to believe that they shouldn't be that way, that they shouldn't put themselves out there. I'm the type of person that tries to help others all the time. If I can possibly help, I'll do it, because it makes me feel good. It doesn't matter to me whether or not the person's going to turn around and stab me in the back. It doesn't matter if they're taking, excuse me, if they're taking a little bit advantage of me. If their need is real and I can help, I will. And I don't do it so much for them as much, well, I do, but in part I do it for me too. I feel good about that, helping a fellow human being. That's something we should all be doing. And I find it very sad that we don't. But I remember, I have this is inherent in me. I've been this way for as long as I can remember. But I also remember my parents telling me not to do that, even when it meant my own child. When one of my children was having great difficulties due to childhood sexual abuse, I called my adopted mother one day and was very upset. I just basically needed her reassurance. Instead, she told me to get rid of my own kid. That I didn't have to put up with that, and I shouldn't put up with that and just, toss the kid away like, she's a broken toy or something. I should have known that's how my mother would have reacted, but I was stupid and was still wanting her approval and her love. I learned eventually not to expect that. But that's what I meant by, for some people, that it's inherent. They can be raised in an environment where that inherent trait is squashed, or that they're taught that it's wrong, so they stop using it. Living every day with a chronic illness and or chronic pain is extremely difficult. It interferes with your ability to get anything done. It's depressing. The symptoms are hard to manage, and the pain is hard to control. It takes mental and emotional strength to keep going day after day when you feel like absolute crap and you hurt. Giving up is a very tempting idea from time to time. For some people, it's so tempting that they do commit suicide, because for them, they just can't take it anymore and they want out. Yet somehow we do continue to fight day after day, and some days it's not even a matter of going, I gotta make it through today, I gotta make it through today, I gotta make it through today. It's a matter of, I've gotta make it through this hour, just one more hour. And on really bad days, it's just this minute, I can make it through this minute, okay, I can make it through this minute. It's a lot of work. It puts a lot of stress on your body, it puts a lot of stress on you psychologically, emotionally. It's hell. And for people to just act like it's no big deal, it's just wrong. Chronically ill patients live with horrible symptoms of the illnesses that they have every single day, many of which include pain. So not only do they have symptoms, say wheezing or heaviness in the chest, difficulty breathing, lightheaded, dizzy, ringing in the ears, whatever the symptoms of their illness are, add to that pain. That's a hell of a lot to deal with. Pain by itself is a lot to deal with, as is any chronic illness. Put the two together and those are some really strong people. It takes a lot of strength to get out of bed every day. And if you can't get out of bed every day, to do the best that you can from bed. Chronic pain patients suffer with high levels of pain every minute of every day, and depending on their illness, injury, and their body's responses, some have to do this without any pain control whatsoever. And that's extremely hard. We suffer from depression, grief, guilt, feeling useless, feeling broken, feeling like a burden on others. We put ourselves down. We often tear ourselves apart for no longer being able to do everything that we used to be able to, and or everything that we want to do. People tend to be hardest on themselves, and this is also true of people who are chronically ill and or chronic pain. Please, people, learn to be a bit more compassionate and understanding. Those of us who fight each day just to make it through are very good at judging ourselves, and we don't need help from others in this area. What we need is support and compassion and kindness and patience. Put yourself in our shoes. Think of a time when you were sick with a bad flu or a bad infection and you felt like utter crap. Now think about this. You'll feel that way every day for the rest of your life. And as time passes, the symptoms will get worse. Now, add to that, you hurt. All the joints in your body, your bones, your skin, everything hurts, on top of feeling like crap. Would you really want to have somebody say such painful, dismissive, insulting, derogatory, and just plain old mean things to you while you are suffering to survive every day and to deal with the hand you've been dealt? Probably not. The golden rule applies. Treat other people as you want them to treat you. And if we can all do that, the world would be a much better place. Chronically ill people and patients in chronic pain do not ask to be sick. They do not ask to be injured. They do not choose to be disabled. These are things that happened to us, not something we went looking for or desired. Many of us have to give up careers or school, give up many of our dreams because our bodies betrayed us and we can't fulfill them anymore. Instead, we have to find other dreams, other ways of coping, other ways of looking at life that would still make us want to live it. And one of those things that is most important is having a support system. People who genuinely care, understand, and are there for us. And everybody deserves that. So the next time you meet somebody who's chronically ill or in pain, stop before you say something. Think about it. Think about how you would feel if somebody was telling you it's all in your head, or you don't look sick so you must be fine, or that disease isn't real, or whatever number of insults that can be said. If it were you, would you want it? The answer is no. So don't do it to somebody else. Instead, reach out your hand. Offer to help, even if it's just to listen. Or offer to do something for somebody you know who is chronically sick or lives with chronic pain, or both at the same time. Offer to take out their trash, or offer to pick something up at the store for them. They would greatly appreciate it. And it might even make you feel good to know that you're helping somebody that you know who needs that help. Be a friend. And if you can't do that, and you don't have anything nice to say, then don't say anything at all and leave the patient alone. That's the thoughts I had on that particular area of judgments, on the illnesses and diagnoses themselves. How each patient deals with it varies. Usually we ignore it to the best of our ability, but that's hard to do when you don't have a diagnosis and you don't know what's wrong. For me, I know what's wrong with me, and I didn't ask for any of it, but I got it. And I've dealt with judgments and nasty people who are just hateful. And I just wish people would learn not to treat each other so badly. Well, I'm going to go and try to take a nap since I didn't sleep last night and I am in a lot of pain. Thanks everybody for listening. If you have any questions, comment below, subscribe above, and I'll talk to you later. Bye.